What if we could heal wounds in days rather than weeks, without stitches, staples or glue, and with minimal scar? Hi, I'm Gerard Chris, CEO of Rapair Medical Devices, based in the beautiful Northern Rivers of New South Wales, Australia. I work with a team of award-winning doctors and postdoctoral researchers, and we have developed technology to rapidly repair damaged skin. In fact, in a human clinical trial of excision wounds, we were able to remove stitches within 24 hours. Normally, these stitches would need to stay in for at least 10 to 14 days. Wound repair hasn't changed much since the Egyptians started stitching wounds together over 3,500 years ago. Current methods, including stitches, staples and glues, follow the same ancient principle of simply holding the edges of the wound together until the wound heals itself. These methods are painful and traumatic. They require training and skill to apply. The wounds take weeks to heal, and 10% of patients are left with a bad scar that can have lifelong impacts upon their physical and mental well-being. The rapid repair wound dressing is a major innovation. It is easy and painless to apply. No local anaesthetic is required. It can be used instead of stitches, staples and glues. It is lightweight, non-invasive, non-toxic, and has a shelf life of over 10 years. More recent innovations in wound care aim at improving the actions of cells within damaged tissue. Our technology is different, as it works on a much smaller scale by targeting the alignment of molecules between the cells. Skin has three main layers. The outside layer is the epidermis, below that is the dermis, and below the dermis is subcutaneous fat. The dermis consists primarily of the extracellular matrix, made up of collagen fibres, proteoglycans including fibrin and thrombin, and other molecules. The collagen fibres are aligned roughly parallel with some cross-linking. These fibres are made up of collagen fibrils, and the fibrils are made up of tropocollagen molecules. In healthy skin, new tropocollagen molecules form fibrils that align and attach to the existing matrix. When skin is damaged, the extracellular matrix is disrupted. The collagen, proteoglycans and other molecules flowing into the wound are unable to align properly and aggregate in a disorganised manner. This random misalignment of molecules contributes to the formation of scar tissue. Some molecules may align with each other, but even a small gap of only 1 millimetre requires more than 70 billion tropocollagen molecules to align to form just one 10 micrometre wide fibre. Hundreds of billions of tropocollagen molecules need to align to form enough collagen fibres to hold the wound closed. The rapid repair wound dressing aims to solve this problem by projecting a fine virtual scaffold into the damaged skin so that the molecules flowing into the wound can align as they would in undamaged skin. This virtual scaffold is produced by tiny magnetic structures within the dressing that imitate physical properties of an intact extracellular matrix. These structures project electromagnetic guidelines into the wound so the diamagnetic tropocollagen molecules orientate in the same direction, allowing them to rapidly form longer, stronger collagen fibres. The field strength of the virtual scaffold varies across the wound to facilitate cross-linking and avoid fibrosis. Our dressing dramatically reduces healing times from weeks to just days and produces a minimal scar. Our team conducted a human clinical trial on excision wounds where a skin cancer or lesion had been surgically removed. Half the wound was treated with rapid repair, the other half with a control. We were able to remove stitches from the treated side within 1 day without the wounds reopening. A panel of 17 surgeons, physicians and dermatologists reviewed photos from our trial. These clinicians knew nothing about our research and were simply asked to estimate the age of the wounds based on their experience. They estimated the age of the 1-day-old wounds treated with rapid repair as more than 8 days old. Here is another image of a wound from our clinical trial, taken a year after treatment. The left side of this wound was treated with the control dressing. The right side was treated with rapid repair. You can clearly see the difference in scar outcomes. In 2020, our team won the NASA iTech competition, beating a range of emerging technologies from around the world. NASA are interested in using our dressings for the Artemis and Moon to Mars missions. We are keen to talk with strategic partners and potential distributors to help bring the rapid repair wound dressing into the US market. If you are interested, please talk to David after this presentation or contact us via email, our website or via social media. Rapid repair. Faster. Better. Healing.